Hi, I'm Dr. Kurisko. I'm a general radiologist. I've also worked as a family doctor, emergency room physician, and a neuroradiologist. This came across my feed today, and I thought it was really interesting. I thought maybe I'd just do a little impromptu commentary on it. This was in LinkedIn, and a prominent radiology group posted the following. There's an posting called CT Scans for Your Heart, and the difference between CT coronary scoring, CT coronary calcium scoring, and a CT coronary angiogram. Here's the preamble. Early detection saves lives. Understanding cardiac imaging options. At this prominent radiology group, our team of radiologists is dedicated to empowering you with information needed to make informed decisions about your cardiovascular health. Our latest blog explores the critical differences between CT calcium scoring and a CT coronary angiogram, two powerful diagnostic tools that can detect disease before symptoms appear. Heart disease remains the leading cause of death worldwide, but early detection through advanced imaging techniques can significantly improve outcomes. Really? Well, I went online this afternoon and I Googled that. Is there any evidence that CT coronary calcium scores improve outcomes? I couldn't find any evidence at all. Now, here's the problem. You do a CT coronary angiogram, and what it does, a CT calcium score, it scans through your heart and shows calcified plaque, which is generally proportional to the total amount of plaque in your coronary vessels. If you have a score of 0, that's actually really good. It indicates that your risk of having a cardiac event in the next 10 years is pretty much 0. But I believe that CT calcium scores can be misleading. Let's say you're 43 years old, you get a scan, it shows that you have no calcified plaque. It doesn't mean you don't have plaque. And that's a little early. That's a little earlier than the time when you start to see this calcified plaque. So people may be misled and think, oh, I can just continue eating at McDonald's. I'm fine. Well, the truth is 40% of people in this country are going to die of coronary artery disease. Let's say you get the scan and it shows plaque. If that information is used to motivate you to change your diet to an Esselstyn type of diet, a low-fat, whole-food, plant-based diet, that's great. But that diet is not generally promoted by family doctors or cardiologists, even though it's very compelling that, in fact, this type of diet will prevent, arrest, and reverse heart disease. So what good is the information if it doesn't lead to behavior change? I couldn't find any evidence that there was meaningful behavior change. And the argument that if it shows plaque, it'll just increase the statin levels. Well, for primary prevention, in other words, people that have never had a heart attack, it requires a lot of people to be treated with statins to actually prevent a single heart attack. For secondary prevention, the effect of statins is probably better. That's people that have actually had a heart attack. The beneficial effect of being on a statin is fairly well established. But the point is, if you're going to get this test and not act on it in a meaningful way, what good is it? The truth is, if you have a negative scan, you should be on a whole food plant-based diet. If you have a positive scan, you should be on a whole food plant-based diet. So if you look at it that way, the value of a CT calcium score is pretty limited in my mind. Thanks for listening.